Malaysia reported a total of 327 cases of HMPV in 2024, a 40% rise from the year prior. Despite the increase, molecular virologist Dr. Vinod Balasubramaniam reassures the public that HMPV is a common seasonal virus, usually causing mild to moderate symptoms.
Human metapneumovirus, or HMPV, is basically a respiratory virus, but it's not a new virus, first identified in 2001. Okay, belongs to the Pneumoviridae family, closely related to another respiratory viruses, which is called a respiratory syncytial virus, RSV, which is very common, right? And this HMPV is very common among infants, young children, and also those who have problems with their immune system. Someone who's elderly, someone who's immunocompromised, and they are seasonal and they have been circulating for some time. It's not something which is new, right? Similar to other respiratory viruses, right? They also spread primarily through direct contact with infectious secretions such as saliva, respiratory droplets when someone coughs or sneezes.
Unlike COVID-19, Dr. Vinod said HMPV is less transmissible and that adequate measures are in place to manage the disease.
Get where the fear is coming from. Generally, when something's brewing in China and everybody, gets worked out, everybody's scared. Can this be the new COVID? Simply because it's respiratory and it has similar symptoms. But one thing that we should know that this is not a new virus. It has been circulating for some time. And, unlike COVID's high transmissibility, this virus doesn't possess, that range of transmissibility. And I think adequate measures are already in place, and we just have to follow them, similar to what we did with COVID, particularly with your hand hygiene, your cough, your sneezing etiquettes. If you are, if you're ill, stay at home. Make sure you don't, spread it to others. While there are no vaccines for this virus, we have adequate measures to manage it. And from what we have seen so far, the symptoms are generally mild to moderate, unlike COVID-19.